Hi, I'm Charlie Hendricks, Medical Director of Surgical Services here at MDI Hospital. We've been hearing how patients are delaying routine care and sometimes ignoring worrisome symptoms. This all can lead to much worse outcomes. We wanted to give you an idea of what to expect when you arrive at the hospital and walk you through the process. We want you to be comfortable coming to MDI Hospital for all your healthcare needs, now as you have been in the past. We're taking all the necessary precautions to keep our patients and our staff safe, including doing as many telemedicine visits as is appropriate. So let's walk through the process together as we've modified it. Be sure and wear your mask. There's nothing more masculine than telling the world you care more about your neighbor's health than the way you look or feel. So a few days before any scheduled procedure, you'll be tested at the COVID-19 drive-up tent in our parking lot. Later, you'll get a follow-up phone call from the pre-op nurse, checking in about your general health and confirming all the details. These tests generally take about 2 days to return, but we do have a much quicker test as needed for emergency surgery. Everyone's required to wear a mask when they enter the hospital. That is one way that we're keeping our staff and our patients safe. Also, everyone who goes through this checkpoint is screened for symptoms and has their temperature taken. Next is your stop at the registration desk. Then it's up to our ambulatory surgery unit. That's our day surgery unit up on the 3rd floor. So at this time, we're not having any family members accompanying you, as we normally would, so we can minimize exposure to patients and staff. If you need help, we'll get a hospital escort to bring you up. Once in ASU, your own pre-op nurse will meet you at the door and walk you through the check-in process. We are taking precautions with staggered times and physical separation of patients in our day surgery unit. Then you'll be given a private locker for your possessions and a space to change into a gown. The hospital has been able to procure more than enough PPE to provide safe care for our patients and staff during this challenging time. Then your ASU nurse is going to introduce you to anesthesia, your OR nurse, and then connect you with your surgeon. You may find yourself recovering in a recovery room for a while. During this time, each OR is totally disinfected and in the standard fashion sterilized with UV light. Upon discharge, the nurse will deliver you downstairs to your family member at the drive-up parking area. In closing, don't be afraid to come to the hospital during this time of the pandemic. Delaying needed treatments can lead to worse outcomes. We're going to be taking all the precautions necessary for as long as necessary so we can all get through this together. We are your community hospital, and we are there for you.